Hello, everyone. We are here.
Everyone.
Valerie Stern Luz, and who is probably one of the most experienced dermatological PAs probably in the world. And I here to talk about. We're going to start with skin products and why it's an integral piece of the puzzle. We're going to talk about how we use them, why we use them with technology, etc. And both of our experiences together and our expertise, because two heads are infinitely better than one. And so, skin products, okay? Yes, from health comes beauty, okay? And so there's a lot of videos already out there from me about what skin products what supplements absolutely you need to be using internally. It's all over the website, JudyTHunterMD.com. And so we're not going to go back and rehash that, but essential. And that's the first thing we do, because when we do that, it makes everything else we do, whether it be skin products, technology, and how we evaluate you, work better. And we've seen it for years.
Absolutely.
Am I correct on that?
Yeah, no question.
If you aren't healthy, if your thyroid's low, etc., then you're certainly not going to get the results. I don't care how much money you spend. I don't care what you do, and you're going to age more quickly, and you're going to look older than everybody else. Never mind more brown spots and large pores, everything else.
Exactly.
But so skin products, okay? Let's talk about. Look, I am very much about non-toxic. And why am I about non-toxic? Because non-toxic is non-inflammatory.
Right.
Inflammation is the cause of all disease and aging.
Yep.
So I'm not going to tell people to use things which cause more inflammation, which means that it ages you more quickly, gives you more brown spots and large pores, exacerbates your acne, etc. And so, but organic
Exactly.
and non-toxic does not mean therapeutic.
Yeah, no, there's no question about it. I mean, our toxic loads are already bad enough the way they are. We are catching pollution every which way. We're eating from plastic and GMOs and all else. The last thing we want to do is be putting on all of these products day after day after day and adding to that toxic load that's just aging us.
And it's in our skin, and the skin, the blood vessels of the skin, then absorb it into our bloodstream. Valerie's also a mold expert, which is a huge issue in today's world, multiple chemical sensitivities, etc. So if you're using toxic products, which is why I've done the videos about you should not be using this, and then people came back and said, okay, what should you be using? Well, I am absolutely about non-toxic. There's a lot of non-toxic on the market, but non-toxic is not therapeutic.
Exactly.
And from our point of view, when people come to us and entrust us with what's going to slow down the clock, turn back the clock, reverse, when we have whatever it is we have, eczema, acne, aging, etc., we want to give them what's the best tool for the job. And so non-toxic, yes, but therapeutic is what's essential. Now, let's start with cleanser.
Sounds good.
Okay, so tell me your feeling, number one, on cleanser. Some people who just use soap and water versus using cleansers that clean out your pores.
Soap and water has a lot of issues with it. The pH of the soap, what it's doing to your skin. Is it clogging your pores? Is it drying you out? Is it adding more toxicity to your skin? Something that you would use on your body may not necessarily be something you would want to use on your face. Mm-hmm. We need to get down in there. I'm a big fan of making sure that if patients are going to wash once a day, let's say, they do it at the end of the day. They've been out and about. They've had the environment and all of its pollution. You want to clean that skin.
Sweat.
Exactly. Sweat,
yeah.
Pollution,
exhaust,
makeup, everything. That's when you really want to get your skin clean, is before you go to sleep. When you wake up, sure, you can wash again if you need to, but you should be clean when you wake up in the morning. So doing it at night is important. And getting a cleanser that's going to work, where it's going to get down into those pores and get to the actual problem areas and clean it out. This
And skin breathes at night.
absolutely. This product, I wouldn't be without this one. Not just because it's Dr. Hunter's, but because it works. This product is made so gently that anybody can use it. You can use it on any skin type
The
after
worst,
procedure.
most sensitive skin.
Exactly. Yet it cleans. You feel that it cleans. You're not going to get tight and dry from this product either, which is another thing. I think there's that misconception that if you've washed your face well, it's going to feel tight and dry when you're done. You don't want that. You're dehydrating your skin and pulling the moisture. You don't get that with this product.
And so it doesn't have any sodium maltsulfates. It's got an ingredient in there that goes in and cleans. I don't care. I mean, look, we can talk about makeup on another video, but makeup is greasy. It's got ingredients that make the skin stick. And so you got to go in there and get that out of the pores,
Right.
because the skin breathes like your lungs do at night to a certain extent. That's part of how it cleanses itself, etc. So it really matters, cleanser.
And one of the ingredients in this, which I'm really impressed with, is the fact that this has an agent in it that's even designed when it's taken internally to do away with toxins in the body. So when you think about it, you've got a product that's containing that exact chemical structure of a product that's designed to extract toxins internally when it's taken orally, but it's right here in the cleanser. So you know that the skin is getting the skin is being cleaned the way you need it to be.
Exactly. So, and again, we're all about how do you start an advanced skin product. So when you come in and you're depleted internally, your adrenals are depleted, your thyroid's low, your hormones are low, you're stressed out to the max, you've been vaccinated and you're inflamed and then what happens is we can't ask your skin to run the marathon initially, and that's why we say to you, look, you got to start with internals, you got to start with skin products, and then we'll do the procedures later, because if we do the procedures, your skin is so depleted, internally you're so depleted. So we make sure you're clean, number one, okay? And the other thing I tell people is always remember to clean out your ears and behind your ears, because people get a lot of pimples behind their ears, skin cancers on their earlobes, etc.
Yep.
And then what do we start with? And we put this also on inflamed skin. We put this also on shingles. And there's a huge amount of shingles nowadays, increasingly.
Exactly. Yep.
But so then we start with serum. And so why serum? Because it's feeding the skin.
Absolutely.
It's like the food truck comes up to feed the hungry construction workers at the construction site.
Absolutely. I mean, it's essential. You have got to feed the skin. You have to do it in a way where you're getting penetration. If you haven't cleansed properly, number one, you're not going to get the penetration you need. And number two, if you're not using the right ingredients on your skin, they're not going to penetrate anyway. It's like trying to put a beach ball into a golf hole size container. You need that molecular structure to be just right. And you can find products all over that talk about how they do that, but when you look at the ingredients and how they're made, there's no way they can do that.
Well, and the other thing is anti-inflammatory. Every ingredient in all these products, there's no inactive ingredient. Every ingredient is active, they all work together. So this is also anti-inflammatory, which is why we put it on shingles. I don't know that you've done this, but I've certainly put it on shingles and watched within minutes as shingles get better, the blisters. We put it on after Botox or injectables.
Right.
And you watch the skin within minutes. You can give the patient a mirror and watch their skin get a better color, just that, where they notice it. And that's because of the activity, the volume of ingredients, and the fact that it's feeding the skin presto, and the skin is starving to death because the skin is the last place the body's going to dedicate its limited resources.
Yes.
So number two is that. Now, some people need moisturizer, some people don't, okay? There are a couple of things that I am a believer in. I use, some people don't need, even with just serum, they don't need moisturizer. Some people who don't need moisturizer use hyaluronic. There's a lot of hyaluronics on the market, but at the end of the day, you put a tiny little fingertip size amount of this because it's the strongest hyaluronic on the market.
Yes.
And the reason we use hyaluronic is
We get a nice glow. We get a lifting of the skin. It helps to soften the appearance of fine lines and wrinkles and just give a nice dewy glow to the skin. Hyaluronic, as you probably are familiar with, and as we know, this is something we inject all the time.
Yeah.
So hyaluronic absorbs its own weight in water or moisture by about 1,000 times. So we can put it in as fillers here and there and have a nice result done. But when you put it on the skin, right on that outer epidermal region, you get just such a better appearance. You
well,
glow,
and it helps
it's
all the lines that we
hydration.
hate. Not
Yes.
that we have any of those,
Oh,
but
plenty of
all
those.
those lines that we hate.
Plenty of those.
And the other thing is mixing serum and hyaluronic
Yes.
together is often enough moisturizer for people.
Absolutely.
And it also prevents dehydration of the skin
Completely.
to a certain extent on airplanes, in cold weather this time of year, even in Florida in humidity or wherever, a little bit of hyaluronic just because it helps with this. Now,
Just
the reason I don't have an eye cream is because when you use this, my feeling and what I see, and certainly you comment on this, is that, I mean, it plumps it up enough and these things are penetrating, so it's redundant. There's no reason to use it.
I completely agree with you. A lot of products, especially when they first come out, they'll have one main product that they're trying to get across and get you to use. Then before you know it, there's an eye cream, a lip cream, a this and a that. That's great, and in some
More
cases,
products.
exactly, there might be something extra with it, maybe a little bit. But when you've got a product line that penetrates to that skin, around the eyes or around the mouth or the face, you don't need something separate from that. It's
Okay.
just something else to buy, and you've got it all right here.
So you and I can go on forever, but
You know,
we're
one
gonna
thing-
advance good productivity.
And men can use these products. All men can use these. There's
Exactly.
no
Men
tint
need to use these products.
Exactly. There's no tint. There's no fragrancy smell to them. Nothing.
These are all medical products.
Yeah, clean, natural products that anybody can use. Any age, any
And a
skin
lot of
color.
men, and a lot of men when they come in, I didn't mean to interrupt, sorry. A lot of men when they come in, I'll start them on serum. And this is how you know if you have a great product.
Right.
If a man comes back and says, well, what more should I be using? Well, then you know that they're seeing the results. They put this on after shaving. Because look, men don't look 100 when you look 50, okay? And then the second thing I put them on is Night Regeneration, which Night Regeneration is the product that, look, the skin uses, what's in this is what the skin uses in the daytime to repair, to protect itself. This is what it uses at night primarily to repair, because the ingredients in this are very different than that. There's a reason you use this at night, that in the daytime, because it's feeding the skin what the hungry workers at nighttime need in order to be able to go to work tomorrow.
Exactly.
Okay? And so Night Regeneration. So when they first start, cleanser, serum, wrinkle filler if they need more, moisture in the daytime, Night Regeneration at night, and then if you've got thin, thin older skin like me, then I also have to use Emudermal. Now, Emudermal basically, the reason that I use that is because nothing penetrates more deeply. People who have never had things that moisturize enough, this is what they add in with serum. And all my products, I try to make it where you put everything in your palm and use it at one time, so that you slap it all on at one time, because nobody has time to la-di-da with different layers of things.
They don't. You can interact them. They can all be put on together.
Yeah,
They're
and you
designed
bespoke
to
it
be
for people.
exactly.
So what does your skin need? Valerie's got thicker skin than me, okay? And so she may not need as much moisture. She may not need this, or some days she needs it, some days she doesn't need it. I need it every day, otherwise my skin feels dry. But if you're feeding your skin what it needs, your skin doesn't get so dry, okay? And then the other thing we then add is vitamin C+. Why vitamin C+? It's a 95% L-ascorbic The other 5% is glutathione, the
Amazing.
strongest antioxidant, puts out the fires of inflammation,
Exactly.
and
Exactly.
it forces new collagen production.
It's brilliant. I mean, there's no question about it. And again, as all of these products are, you can put that vitamin C in these products, whether it's daytime
Mix
or
them in,
nighttime.
yeah.
Mix them in exactly.
And the other thing is after Botox. I mean,
Yes.
we have people who have lines
Yep.
that even with Botox, they're not going to fill in. And so we have them start on vitamin C because it knocks back the length and depth of fine
Right.
lines a good 40 to maybe 50% if you're good on the inside, and with rosacea, etc. But I'm also helping. So when we do a therapeutic intervention, we're trying to make it better.
Exactly.
So the other reason why you're using skin products. And then the other thing we keep adding, because exfoliation, let's talk about that
Right.
for a second, okay? 'Cause
Very important.
exfoliation is key.
Yeah, key. I mean, without
Talk about
exfoliation.
exfoliation. and why.
Exfoliation is something that we all do naturally when we're young. When we're a child, you see these beautiful, bright, glowing faces. They're even, they're smooth, and the light just bounces right off of them. Their skin is exfoliating so very quickly. They can cut themselves or harm themselves, and it heals, and
And they
look
make
great.
new skin so
Exactly.
quickly, which is why they
Exactly.
heal so well.
Exactly. As we get older, as we know, things change. We start to get a bit mottled. We start to look a little bit more dull. Our pores might
Yeah.
get a little bit deeper. Our skin gets a little more yellow or whatever. Everybody's a little different. But we no longer have that glow where that light just bounces right off of us anymore. So all of a sudden, we find too, as we're getting older, we don't exfoliate as fast. So when we are slowing that exfoliation product, what we're doing is we're keeping those outer epidermal cells staying stuck on.
So it's dead skin just
Just
stuck on it.
exactly, it's like the lawn needs to be mowed, so to speak,
Yeah.
and it's just sitting there and it's not really doing anything but staying stuck on, because internally things might be happening as well, but externally we're not feeding the skin what it needs to
Yeah.
remove
We're
those.
slowing down internally. So what we do, okay, there's two ways we do it. There's a couple different ways we do it. Number one, and this is where you and I are going to talk about also in another video about how we evaluate people and figure out. So a lot of times with acne in particular, people are very inflamed. We'll start with exfoliating repair. The reason is it's very anti-inflammatory. It's exfoliating. It's a kinder, gentler way to start.
Right.
And we look at people and figure out, okay, how depressed are they internally? How depleted are they? And we may start with that, or we may decide to go right to peel,
Exactly.
which is the strongest one, but it's also helping to get rid of brown spots, etc.
Exactly.
Which we all loathe as we go down the
Oh,
path of life, and we
yes.
have technologies for that. Okay, or we might decide to start with the pads, which you use on your body. Look, everything you can use on your body, but at the end of the day, we need to not
Yes.
forget that we want our bodies to look the same age. Okay, so yeah, we got to exercise. Yeah, we got to be right internally, but you've also got to treat the skin of the body.
Exactly.
And so these pads basically are helping to get rid of melasma.
Right.
They're helping to exfoliate. So what we choose to use, ultimately, we're using all of the exfoliants, because if your skin gets robust, especially if we've done procedures,
Exactly.
etc., on you, and you know you've got you in good shape, we're using all of these. We're using Peel at night. We're using the Whole Body Renew in the daytime. We're using Exfoliating Repair every 2 weeks. It goes in, it cleans out the blackheads and
Exactly.
whatever.
Mhm.
Because originally when I made it for estheticians because they struggle so with extractions. I was trying to make it easier for them. And then the other thing is we add vitamin A plus. Now talk a minute about Retin A ultimately and vitamin A plus, and why we start with one and why we use the retinoics, the retinols. With retinols have to be stabilized, etc.
Exactly.
Talk about
Retin A is probably something everybody's heard about. I mean, in this day and age, they've heard the name brands, they've heard the name Retin A and whatnot. It's just kind of become synonymous with acne in a sense. And also too, wrinkles. People are using it for that. Retinol or retin-A, retin-A is tretinoin, and retinol is the metabolite of tretinoin. So it's a little bit less aggressive, we could say. It's also something that can be purchased over the counter, so they can find it out and about and wherever. So when we look at these products, the goal is to use something that's designed to exfoliate, or it's going to help to lift and bring all the impurities to the surface, and then help to stimulate in the brown spots, exactly. Brown spots,
damage,
acne, sun damage, scarring. My goodness, just about anything. I mean, even little stuck on little like seborrheic keratoses, blood supply, the whole bit can be helped with this. And so it gently, or maybe in a slower way, the retinol will bring that to the surface and help to lift and slough and help to push the exfoliation and get it to happen for you.
So, the other thing I want to interject is that all retinols are not created equally, because you have to have, number one, you have to have a stabilized retinol, otherwise it degrades in the bottle, you got nothing in the bottle. So you're wasting your money, your trust, your time, your effort, your everything.
That is one of the worst things, when somebody sees a pretty bottle and all of a sudden it's like, oh, but this one's a little less expensive, you know, and it looks
There's a reason
There's a reason, and this is the thing that I don't think a lot of people understand. We want you to know this. You know, we don't care where you're buying what. We want you to know so that for your own benefit, you're getting the right product.
That's why we're doing that.
Exactly.
Yeah. And so retinols, and then ultimately retin-A. So this is a prescription, okay, tretinoin.
Right.
But I make one that's it's the only non-toxic one on the market because it's in a non-toxic cream. It also has some other ingredients in there to make it more therapeutic.
Which they are. Just from my own experience and the experience of my patients, everybody says to me, I thought this was vitamin A or retinol or retinoic or whatnot, but it works so much better. And there is a reason, and it's exactly like what's in the cleanser or in the Emu-Dermal or any of these other things. There's a little bit of extra that makes them work just that much better.
And that is the other thing, is with the Neodermal that's in the Emu, it's supposed to be the most important new ingredient to stimulate collagen production since tretinoin.
Oh wow.
Okay, and that's why I put it in there, because Emu pulls it into the skin.
Yeah.
Just like if you need to put anything and pull it into the skin, a lot of acupuncturists, whatever, use things to pull things into the skin they can't pull in. Now,
can a pregnant woman use this?
Absolutely.
So there you
no
go.
Problem. Pregnant woman can use it, and great for stretch marks.
Exactly.
Great for preventing stretch marks.
Totally.
Absolutely.
Or somebody that's young and they're growing tall fast, that wants to avoid a lot of those growth
stretch
marks. Exactly. Something like this would be very helpful.
Yeah,
in
and
that
vitamin
situation.
C really good for that, because it helps fill in any of those. It's making new collagen so it can keep up with the demand.
Exactly.
The quick demand. Okay, now, a couple other things, and then we'll cease and desist. And that is, look, the other thing, Cell Optimizer. Cell Optimizer is my most expensive product, but there's a reason it's expensive. Does it moisturize? Yes, but it's not moisturizing more than what it is really does moisturize, but it doesn't have any oil in there. And what it has in there is things that lift and tighten and give the skin memory to lift and tighten.
Absolutely.
So theoretically, we're doing less procedures on people, but so there's a real reason for this to exist. People are using this in the morning because it does lift and tighten to the point that when they quit using it, they'll start using it again after a month because they see the difference. And then the other thing I want to throw in, let's talk about the bones for a second.
Absolutely.
And why I have tooth pattern, why I care about people's teeth being thin. Because let's talk for a second about the fact that all these lines, jowls, etc., it's not just the skin thinning, it's
bone. Absolutely. It's
muscle, bone, teeth.
All of this. We're losing bone, muscle, everything as we age. Everything is also going south with gravity. So you think about it, we're losing it, we're getting demineralization in the bones, we're losing some muscle activity.
And our teeth are getting thinner.
Our teeth are getting thinner. And if you grind or anything like that, you're grinding them down, and you're grinding down on this. And when you chew on one side versus the other, you will see an asymmetry going on, and this can be a problem. But this product is one of the products that I really hadn't thought about until I really started to pay attention to it a little bit more. And now I can't be without it at all. I'm amazed by what this actually does.
But it's also when you go to the dentist, what you'll have the dental hygienist tell you is, why don't you have any plaque? Well, this is why you don't have any plaque. But I really did it because I was thinking about how teeth thinning, never mind bones, which is why it's not just about the skin aging. You got to think about your bones, strontium. There's all sorts of things that you got to do for your bones, exercise, all that sort of thing. And why these two are sitting out here now, because the muscles really matter too. And part of what it occurred to me is, look, we put DHEA. Now, everybody doesn't need DHEA. Your DHEA has to be low. You're going down the path of life. And ultimately, you need DHEA when the skin, the neck starts to thin. I don't put it on the face because sometimes it can give you a pimple, but in a lot of people, it doesn't. And so I started putting it on the neck to help with all this thinner skin, but it's the muscle, that little platysma muscle that's woven in there, and how thin it is to help thicken it. And then also, everybody doesn't need this, but as you go down the path of life, estriol support is about thickening the skin itself. It helps lift and tighten to a certain extent.
It gives us that bounce back to your skin. That I mean, I can remember those days when it was like one day I thought I looked great, and the next day I looked in the mirror and thought, good grief, what just happened?
Yeah.
And it's that loss of the estriol that was taking place that we women at a certain age start to notice. And all of a sudden we're looking at our necks, we're looking at our arms, we're looking at our
crinkles,
faces.
Our vaginas get dry.
Everything.
Whatever.
Everything.
Yeah.
This is something at that stage of the game that can definitely help. And
non-toxic cream, most importantly, which when you go to the compounding people, you think you're getting a non-toxic drug, but in fact, it's the cream that they put it in that's the huge problem.
Absolutely.
So wrap up. Why do we use skin products before everything?
That's just it, and that is exactly what I was just going to say. Don't wait until you're 40, 50, 60, 70 to do this. Mm-hmm. If you are 40, 50, 60, or 70, begin it. There is never a bad time to start. But if you're watching this now and you are sitting there and you're 20, 25, 30, now is the time to get started. The sooner you start taking care of yourself, the better you're going to be.
The slower the clock ticks.
Exactly. And as Dr. Hunter mentioned, and in all of her products being so non-toxic, think about every day that you apply products from your teen years on, and all of that potential toxicity from those things that's getting put on day after day after day, year after year. You stop that with this too. You are definitely stopping the clock. You're also, it's anti-cancer. There's so many
anti-skin cancer.
Anti-skin cancer.
It helps. We have to say it helps.
It helps. It can help because it helps to keep the skin optimized for the most. But you're going to see yourself looking better longer.
It's anti-skin damage.
Yes.
So when you're out in the sun and all the things that happen, life happens.
Right.
Okay. It's helping to prevent, reverse, and yes, you want to start early. Is increasingly as we deal with people younger and younger, because people are aging more quickly now.
Yeah, absolutely they are. I mean, it's the environment, it's the stress, it's the way we eat, it's a combination of everything. Genetics is one thing, but environmental factors is a complete other thing.
And genetics are a bigger and bigger issue nowadays.
Absolutely. We are kicking on things today that we never turned on years ago. And because of that, we are increasing inflammatory issues internally, which is causing a lot of stress, and it's causing a lot of aging factors, not just on our skin, but internally.
Okay, so we've gone on too long, but at the end of the day, it's because we know a lot and we like to share it with you, and education is, knowledge is power, is what it boils down to.
Absolutely.
And we hate for people to have their trust betrayed, and so look, even if you're using other things, we always punctuate, as I say, with some therapy. I mean, there's some of these things, if you can't use everything, even if you're using some of the things that are exfoliating more significantly, vitamin C, vitamin A, I mean, those are the things that are helping achieve your goals. So, thank you very much for listening.
Thank
We
you.
hope this was helpful for you, and we're going to do more very soon
Great.
with how do we evaluate people and what technologies do we then step to.
Absolutely. Sounds good.
Thank you.